What is haemophilia? Haemophilia is an inherited bleeding disorder which occurs when the blood lacks clotting factor. This clotting factor is an essential protein which controls bleeding. However, this bleeding condition is caused due to mutation located on the X chromosome that provides instructions for making the clotting factor proteins needed to form a blood clot. This mutation can cause clotting proteins to not work properly or not work at all. There are many various symptoms when it comes to haemophilia. These are bleeding into the joints, which can cause swelling, pain and tightness, often affects the areas of the knees, elbows and ankles. Bleeding in the skin, which is bruising, or muscle and soft tissue causing a build-up of blood in the area, otherwise known as a hematoma. Bleeding in the mouth and gums. Bleeding after circumcision. Bleeding after having shots, such as vaccinations. Bleeding in the head of an infant after a difficult delivery. Blood in your urine, or frequent hard-to-stop nosebleeds. These symptoms are all signs that the clotting factor in the blood doesn't know how to work properly. This means that it will take much longer than usual to stop the bleeding. Due to this, patients with the condition are put at serious risk in terms of blood loss and damage to joints and various tissues throughout their body. Now, a female possesses 2 X chromosomes, and males have 1 X and 1 Y. Mutations for this disease are X-linked recessive. This means that if a female carries the disease on one of her X chromosomes, she might not be affected by it. However, in Y chromosomes, they don't consist of factor 8 or factor 9, which means males can't make up for the X inactivation like females can, because they have 2. However, a mother who carries the disease on one of her X chromosomes has a 50% chance of passing the disease down. An affected father, however, will always pass the gene down to his daughter. However, his son cannot inherit the disease from his father. This trait is recessive. To diagnose a patient, a doctor would perform certain blood tests to show if the blood is clotting properly. If it does not clot properly, then they would do clotting factor tests, also called factor assays, to diagnose the cause of the bleeding disorder. These blood tests would show the type of haemophilia and the severity of it. About 1/3 of babies, however, who are diagnosed with haemophilia have a new mutation not present in other family members. In these cases, a doctor might check for haemophilia if a newborn is showing certain signs of it. Current treatment for haemophilia is to replace the missing blood clotting factor so that the blood can actually clot properly. This is done by infusing commercially prepared factor concentrates. People with this condition can learn how to perform these infusions themselves so that they can stop bleeding episodes, and by performing the infusions on a regular basis, called prophylaxis, can prevent even most bleeding episodes. When it comes to biotech, there is currently some biotechnology available for this condition. The ultimate goal of gene therapy is the replacement of a defective gene sequence with a corrected version to eliminate disease for the lifetime of the patient. Treatment of the disease can be quantitatively measured through well-defined coagulation assays, eliminating a problem that plagues gene therapy efforts for many other disease entities. This simplified approach relies on a delivery mechanism to provide a corrected copy of the defective gene, without removal of the error-containing genomic sequence. However, this gene therapy has a low recorded success rate. Due to the absurdity and how rare this disease is, we must fund for these patients affected. The current treatments can both be further corrected and help patients and scientists get a better understanding of this unusual recessive trait condition. This disease can permanently affect patients' joints and blood level for the rest of their lives, which is why it's so crucial to be able to permanently cure this disease with a high success rate. Overall, funding for this disease would heavily positively impact both scientists and patients in their overall knowledge and understanding of this unusual yet threatening disease.